The Ministry of Health has been in the spotlight of recent after it appeared in the Auditor General's report of 2020 for mismanagement of funds. According to the report, up to 1.3 billion kwacha from coronavirus resources from February to July 2020 have been mismanaged in various transactions, which included dubious transfers from government accounts and cash withdrawals. In this vein, the Non-Governmental Gender Organizations Coordinating Council (NGOCC) has joined stakeholders in calling for those involved to be investigated and for justice to prevail. NGOCC Board Chairperson Mary Mulenga says the NGO was one of those that donated and feels that the donations could have been coordinated better with clear accountability.
It is an undeniable fact that women and children stepped into the COVID-19 pandemic from a position of vulnerability, given the income and gender inequalities that have always existed in our society. Obviously, the measures taken to contain the spread of the virus, such as the partial lockdown, the social distancing, and other measures that were put in place, have had a telling negative effect on business activities, more so in the informal sector, where most of our women and youth are the majority. We are also aware that the government stimulus package that is being administered by some selected commercial banks may not directly address the immediate challenges faced by the informal sector. In addition, we have witnessed the unprecedented levels of sacrifice that has been exhibited by our medical personnel, some of whom have been doing so under very difficult circumstances. We have been reliably informed of the limited availability of personal protective equipment, or PPEs as they're commonly known, and in most cases, COVID testing kits have been insufficient to broaden testing exercises aimed at safeguarding citizens. The country continues to register devastating effects of the pandemic, with the Ministry of Health confirming a total of 349 COVID-related deaths countrywide out of 16,543 cases recorded. In the recent past, I'm sure you've been hearing our Minister of Health, Honorable Chairperson, warning of a second wave of the anticipated increased numbers with the onset of the rainy season. With the above scenario, it is therefore unthinkable that anyone would take advantage of such a crisis for personal gain. How can anyone defraud or pocket resources meant for the frontline medical staff whose lives have also been endangered as they discharge their noble duties? How can anyone ignore the fact that many people out there, especially our women, risk losing lives as a result of limited facilities and attention to facilitate their maternal health needs? This selfishness of a few individuals put our country in great jeopardy and totally disregarded the sacrifices of many that gave up their own time and resources to help through various donations.
Ms. Mulenga says the board has also noted several concerns from the Auditor General's report that the Ministry of Health has failed to do.
Failure to prepare monitoring and evaluation reports at provincial and district level. NGOCC notes from the Auditor General's report the failure to provide consolidated and more coherent data which should have been generated from the monitoring and evaluation reports to aid in analyzing the dynamics and subsequently effective management of COVID-19 and its related response plans. NGOCC is interested to know the extent to which COVID-19 is affecting women, girls, men and boys, the aged, persons with disabilities, and children, including other key disaggregated data such as age analysis.
The NGOCC Board Chairperson has demanded that apart from administrative measures, justice should prevail where those involved are investigated and made to pay back. She says they should also be relieved of their duties. Zipporah Mushala, Movie TV News, Lusaka.